It is an absolute huge honor for me to be podcast interviewing live from Scotland Mike Gow, who is a mentor of mine, who is probably the number one leader in dental hypnosis, cognitive behavior therapy. And your genius insight to me was that when someone has anxiety and you just knock them out with sedation to fix a tooth, and that person walks up, you didn't treat their brain, and you're really at the forefront. Take us back in the day, where along your journey did you get interested in the human brain?
It's something I've always had an interest in, but I guess the journey truly started when I was a student. One of my first patients was this sweet, dear old little lady who needed a new denture and a couple of fillings, and she was in the student clinic, seeing 21, 22-year-old me. And she was terrified. She was absolutely petrified of getting this work done. So I was quite amazed at how much I enjoyed supporting her, helping her get through her treatment. All my friends were, I've done the best crown, and look at how close to the apex I got. And when I got to the end of her treatment, and she gave me this huge hug and said, you've changed my life. And she brought me in a gift. She brought me a pen with my name engraved on it, and then she didn't have 2 pennies to rub together. And she saved up her money and got me a gift to say thank you. And the sense of job satisfaction I got from that, I knew right there and right then, I'm in this to help people. I want to get paid money and earn a good living, but I want to help people.
So how does a dentist learn more about dental anxiety management?
Yeah.
And how does someone start that journey?
I think one of the issues is
because in America,
yeah,
they're going to say, well, go to a doc sedation course.
Yeah.
Just go learn to knock them out. And that's not what you're all about.
No, well, first of all, my premise is the quote by Maslow, Abraham Maslow, who's a psychologist, and he said, if the only tool you have is a hammer, every problem begins to look like a nail. If you've got sedation, and I treat sedation treat anxiety with sedation, and I've spent money on training in it, I have all the equipment, guess what? When a phobic patient comes in, they're going to have sedation. So I kind of see myself a bit like a good bartender. If somebody comes in, right, and they want a cocktail, right? If you've got a cocktail bar, okay, and someone comes in and they say, I'd like a drink. Have you got one drink that you'll offer them? Do you just give them, well, I've got beer, or I can give you an orange juice? Is it a single drink? Or do you say, great, you've come to our cocktail bar, and guess what? We have all these different things that we can do, and as an individual, we're going to mix your drink exactly the right way for you. So sedation may very well be the right treatment or the right approach for somebody with anxiety. It might be behavioral, it might be hypnosis, it might be time, or do you know what? It might be a combination. You might be using sedation and behavioral techniques, and it's just finding the right balance, the right mix for that individual person. The person who comes to see me very rarely says, Mike, I've come for hypnosis, I've come for sedation. They come in and say, Mike, I'm terrified. Okay, and then it's up to me to find out what the right mix is for them to get them through it, not just what I happen to have trained in or prefer. So when I started off, the prospect of sedation terrified me. I putting a needle in someone's vein and injecting a drug. I liked the psychology, and that scared the hell out of me. But I thought, how narrow-minded of me with an interest in phobia management would it be? You come in and I say, I can't, or I'll send you to another guy. I know I'm the phobia guy, but I can't do sedation. So I made myself do the sedation training. I went and got a postgraduate certificate. I did at the dental hospital so that I could do it. And what I found was, like anything, you stay within your comfort zone, you treat the appropriate cases. It's a great technique. So when I was young, you had guys who treated phobia with either sedation or behavioral. And these tended to be very much in one camp or the other. The reality is you need a mixture, and it's different for each patient. And it's sedation, it's behavioral techniques, it's studying injection techniques. If you can give a pain-free injection, that's massive. It's huge. It's using technology. You know, what equipment's out there that we can use that make our life and the patient's life easier. You know, as a dental student, there was very little education in dental anxiety management. You know, you had an hour lecture on, you know, you might get some patients that don't like to come to see you, and here's a couple of things you can do. And that seemed disproportionate. It was like, and there was also an attitude of, you know, Mike, these patients are really nervous, so you probably won't do as high a standard of dentistry with them, but, you know, they're nervous, so just do what you can, you know. You have to make compromises. And that never really sat well with me. Why just because they're anxious? Why are they not having a root canal when we could have done a root canal to save the tooth? And we're saying, well, they're phobic, so just take it out. That's not right. So it's finding the approach, the education to the younger dentists. It's looking at what we're doing and offering more to the patient.
In all honesty,
yeah,
in America, I know my country the best. If I said this dentist does hypnosis,
yeah,
they'd think quack, crazy. Yet you blew my mind. You had the BBC. Mm-hmm. The BBC, I mean, that's the most prestigious news organization, hands down on the planet, come into your office, and it's on BBC, it's on a YouTube video. Do you have that on YouTube?
I've not put it on myself, but it's on there. That's been copied by 100 people, kind of thing.
Yeah,
so.
I'd love to post it, or
sure.
Or if you ever create a course for us, you can start with that.
It'll happen.
Because that would be the intro for the course, and you hypnotized a woman.
Yeah.
And extracted 2 failed root canal teeth that had apicoectomies. You extracted them, placed an implant, no anesthetic.
That's correct.
And I think if I would have watched that video and it would have been on your website, I'd think, yeah, right. He numbed her up. But the BBC was there. I doubt you pulled one over on the BBC journalist.
No, absolutely
because
not.
She was with the patient before, during, after.
Yeah.
Did you numb her up, Mike, or did you really pull 2 teeth and place 2 implants with hypnosis?
We really did it, and here's the thing that fascinates me about the public perception of hypnosis. Hypnosis and the influence of how we interact with fellow humans, that's something we've been aware of for hundreds of years, millennia. You know, the ancient Greeks used it, the Egyptians used it with sleep temples. You know, you would turn up with your problem, they would put you in a special room, the priest would sit with you for a while and say things, and you left having got better. Now, what is that? That is a form of words influencing how you feel, which is what hypnosis is. You know, the first tooth that was extracted using just hypnosis, when do you think that would be? When was the first tooth taken out with hypnosis?
I don't know.
It was 1836, right? 1836. That's long before the vast majority of modern dental.
What country would that have been in?
It happened, actually. There were 2 cases. One was in Paris, and it was a dentist called Ude. But I believe about a month later, somebody did it in Boston. So the American missed it by about...
Let's just go with the Boston story. We'll rewrite history.
I don't know a huge amount, but I just know that that's when it happened. So what interests me is when the media comes to me and says, you know, Mike, you're the hypnosis guy, so can you take a tooth out with hypnosis? And I'm like, well, we were doing that before we had anesthetics. You know,
before they had BBC.
Yeah. So the point of it is that, so we were using this before we invented the drugs that could help manage the pain. Okay, we then invented the drugs, which, yes, are faster, they're more predictable. You know, out of 10 people, the drugs will work 10 times. So we know that that's going to work. And we kind of, in our minds, in medicine, we thought, well, we've nailed it. So forget all the being nice to people, saying the right words, using these behavioral techniques. We'll just give them the drugs. And we forgot all about the psychology, which is huge. It's important. So when I did, you know, this thing with the BBC, And I've actually been filmed a number of times with different documentaries, and each time it's the same sensationalism and wow, are you really doing a sinus lift? We've done sinus lifts, and it's like, really, are you doing this? And it's like, well, yeah, we've been doing this a long time. Now, I'm not saying that I want to carry out all my dental treatment with no local anaesthetic, because dentists look at me as if I'm crazy. I mean, is this how you really do dentistry? No, it's not. We did these procedures, we recorded them with the BBC to prove, and this is the crux of it all, if we can take teeth out and place implants and do sinus lifts with zero anaesthetic, imagine how powerful that is if we do it alongside a local anaesthetic. See those cases that are difficult to manage? If you're using and you don't even have to use formal hypnosis for this to work. If you say the right things to the patient as you're injecting, that case becomes easier. You know, the advertising guys know this. Pepsi knows this. All the huge industries. Apple knows this. They know how to say the right things that will make you feel a certain way about their product. But in dentistry, we've got, I'll give you the shot, and then I'll just not say a word and pull your tooth out, and you'll be fine. You know?
Yeah, and I noticed, and my boys too, when Greg, Ryan, and I took your course, I mean, not only did it apply to the anxiety patient, it applied to every patient, it applied to your staff, your relationships, your kids, your dad. I mean, these are communication skills for every situation in life. But by the way, I must admit, your 4 children, who are between about 3 and 9?
3 and 9, yeah.
Those are the most well-behaved, most literate. Their language skill. When your 3-year-old talked to me, I was like, "My God, is this like a little man?" I mean, so obviously, I mean, you're a great parent too. When I met your kids, I thought, man, I should have just adopted. I should not have had 4 of my own. And so these applies to everything. It
applies to every form and every part of your life. Now, again, ironically, when I first studied hypnosis, there wasn't such a huge emphasis on the importance of language, communication skills, rapport building skills, and actually that's the crux of it all. I mean, that's the crux of hypnosis. But that's the crux of being a dentist, of being a healthcare provider. Now, a lot of the people listening to this, because they're in healthcare, because they're dentists or hygienists or nurses, they probably have reasonably good people skills. Otherwise, they wouldn't have got to where they are and be working with people. But if you can actually dissect and understand the influence of what you're saying and how you're saying it, and it seems very conversational, and as if, Mike, he's just, I like spending time with Mike. I get on well with him. But actually what you're not aware of is I've studied how to say the right things, how to sit the right way, how to engage with you so that I can maximize the impact of what I'm saying. Now, when you're using that with a phobic patient, you're ahead of the game massively when it comes to them being able to provide the treatment that they both want and need to have. And think about this, because I never got into this aspect of dentistry thinking I'm going to make lots of money. I got into it because I was passionate about it, I enjoyed it. But what I quickly realized was that here in the UK, if you work in phobia management, you're either working in kind of government, and in fact it's all government, you're working in hospital, or you're working in what's called community dentistry, because your general dentist is saying, I want to fix your tooth, but I don't have time really to do this. So you go to the government system. And for years I thought I would love to have the time that I need to help people. So either I'll have to work in hospital and sedation departments, or I can go out on a limb and work and open a private practice and say, I will take the phobic patients, come and see me. Now, in America just now, it's an estimated between 9 and 15% avoid the dentist because of fear. Okay? 9 to 15%. So if you're working in a dental office, in New York, San Francisco, a rural town, I don't care where it is, there's 9 to 15% of your immediate demographic that's not going to a dentist. Okay, guess what? They need implants. They need veneers, they need crowns, they need endo, they need all the stuff that everyone, and you're fighting for a market for cosmetic dentistry with the guy down the road who's providing veneers to the same demographic. Now, I truly believe you have to be passionate about phobia management. There are some dentists potentially going into phobia management because they understand there's a niche in the market. But I think the point is you have to engage with that, because if you don't naturally have a passion for helping phobic patients, I think they'll probably see that. They'll be aware that you're just after selling them treatment. But the reality is, if you enjoy your dentistry because you enjoy people, guess what? If you start helping folk that are anxious, there's a huge market out there for you.
Yeah, I think it's amazing how I've been in hundreds of offices. Maybe I've been in 1,000 offices, and the dentist will be talking to me and everything. He'll say, "Hang on a second, I gotta see this patient real quick." And the X-ray will be on the view box or up on the computer screen, and the dentist will just walk in there and look at the X-ray, say, "Margaret, she has a DO on 3," and then I'll turn to the patient and say, and then come back out and talk to me. And it's like, you went in and you looked at the X-ray. You told your assistant she needed a DO, and then you just tapped her, and it's like, oh my God! I mean, it's. But let's start with the basics. It's about communication to a patient, and the first thing you got to get over is a pain-free shot. And you talked a lot about in your lecture yesterday. You use a technology shot. You use a technology. You use what, the wand?
Yeah, there's a few things I use. What was
the other one, Ryan, we heard yesterday in London? I can't remember.
Oh, there's quite a few. There's a Quick Sleeper, the wand. There's one on the market.
One's made in America. Quick Sleeper's made in London, right?
I'm not sure.
Yeah.
I'm not sure. And there's one called Digiject, which is made in the UK here as well, which is a handheld thing as well. The point is, when I first started. Looking at injection techniques, I said this yesterday as well. I firmly believe that, and this is the whole point of, we'll get on to ISDAM, but when you're studying something, I found I had to go to so many different places to learn phobia management. There wasn't a central point for it. I had to go and do the sedation training, and then I had to go over here for the behavioural, and then I had to go and find out how to give pain-free injections from here. So I studied with under Stanley Malamed, who is I think he's San Diego, isn't he? He's in that neck of the woods.
Is he UCLA?
Yeah, that's right.
Or USC?
Yeah. In fact, no, San Diego. I think of Ash Goodman, who's a big phobia guy in the States. So you have to move.
Stanley Malamed's the only great speaker I know who doesn't have time for my show. You know Stanley Malamed. You tell him I'm harassing him on. And
I just gave him a plug, so he should listen.
Come on, Stan, come on our show, because giving a pain-free, you got to get down a pain-free shot.
Yeah.
If you don't get down talking to your patient in a pain-free shot, you've already fallen down out of the gate.
That's the thing. I can be as nice as I like. I can use all the behavioural tools that are in the box. I can sedate somebody, but you know what? If I give a painful injection, they're gonna move and they're gonna be upset with me, even if they're sedated.
So how do you give a pain-free shot or a painless shot?
There are a few things. One, and if you're using standard handheld syringe, and for years I said, look, why would you want to drive? For me, I drive a manual, a stick, and why would I drive automatic if I'm good driving manual? But I then started to get a kind of pain in the tendons in my hand, because one of the biggest things with a pain-free shot is speed, and it's going slowly. And do you know what? The research shows if you deliver an injection slower, it's absorbed quicker. So it blows my mind. Oral surgeons will fire it in 5 seconds, thinking we'll get going sooner. It actually takes longer to get numb. So it's a very, very slow delivery. Even before that, it's the psychology. We know if you're anxious, you feel things more. So that's a part of it. Bring the anxiety down. Initial puncture is an issue, so use topical anesthetic. How long do you think you would put topical anesthetic on for if you're using it?
2 minutes.
That's it, about 2 minutes. And so many people would just wipe it on for a few seconds. They
act like it's a lubricant.
Yeah, that'll give you some placebo effect, but it ain't numbing anything up. So topical, keep the tissues taut. Distraction techniques while you have the initial insertion. So take the patient's mind away from what's happening. I'll get them to open their eyes just before I insert the needle. I'll be rubbing using gate control theory, moving my finger around. With kids, I'll ask them what the most stupid, daft song is that they can think of, and together we hum this kids' cartoon theme tune, and they're laughing as you give the injection because you've distracted them. You then deliver it very slowly. It's got to be warm as well, so it's not an issue in Phoenix, Arizona, I wouldn't have thought. But here in Scotland in the winter, if you come in the morning, and what I do in my test is if I put the cartridge against the back of my arm, and when I take it away, I can still feel where it was. That's too cold to inject. So just run it under the hot tap before using it. And that's about it. It's time and technique. It's learning other injection techniques like the Akinosi block. It's an amazing technique to learn how to do. It's a high dental block. Using the technology, the wand, the Digiject, that don't look like injections. So I found when I switched to digital, it still gave a very slow local anesthetic, but I wasn't getting the pain in my hand anymore because I wasn't having to put my hand in this really awkward position. But also the patients loved it because it didn't look like an injection. It didn't look like anything they'd had before. So kids weren't fearful of it. I said, I've got a magic wand. We're going to make your tooth numb. And they go, this guy's a magician. That's amazing.
So if you gave 100 shots, what percent of them would be with the wand?
I'll depending on the case, I'll use the wand or the Digiject. I would say probably 90% with technology.
Digiject.com?
I think it's .com or .co.uk. Pretty sure it's .com.
And how's it going?
It's okay, but again, I guess the problem with these companies in selling things like this is the average dentist is going to be saying, well, how do I make money out of that? You know, that's not going to make me a crown. So it's getting the perceived need across to the dentist. But these things are practice builders. You know, if you've got a phobic patient in the town where you live and there are 10 dentists, and he's terrified of shots, guess what? He's going to come to the guy that's got the wand or got one of these devices because he hates injections. So your outlay might be a few $1,000s, but this guy's coming in and and the phobic patients need a lot of treatment. Often they've not been for decades sometimes, so they're needing a lot of treatment.
Do you remember that the thing they sold on TV, the sleeper, the Snuggie? You know, the Snuggie reminds me of marketing because the Snuggie's out of business because they sold like a gazillion of them. Yeah. And then they went out of business because no one's ever going to buy one again. And there's only so many people that are going to buy a Snuggie. And Dennis always talking about marketing and new patient and website divine and getting people in. Yeah. But they never talk about retention or patient loyalty. They don't spend money in patient loyalty. Yeah. And the one thing I've noticed in all dentists around the world is that after they've been practicing 10, 20, 30, 40 years in the same village, they still need new patients. Yeah. And it's like, what happened to all the people that came in your front door and never came back? Mm-hmm. And then they don't want to listen to someone talking about communication skills or a pain-free injection. They don't want to invest in a wand, but they'll invest in a $3,000 direct mail piece or a new website. They always, and I think new patients are the drug that mask your inequities of having your back door wide open and having all your customers leave and not come back.
Absolutely. But interestingly, in the work that I do, and I'll say this to patients at the very start, it's my objective to get them to a point where if they need another dentist, then they could use another dentist, because there's a risk of me creating a group of patients who feel they can only see me, and that isn't healthy either, because if I go on holiday, I come out to Phoenix, come out to Vegas to the townie meeting, and one of my patients gets toothache and I'm there, they're in trouble. So I want to help them overcome their fear of dentists without, because again, I've heard dentists say, I'm so good with phobic patients, they can't see anyone else. That's not a solution. That's not a solution. You want to help them understand that the story they've told you about the 5 horrible dentists that they had is awful. But there are some nice guys out there and nice girls who will treat them well and they'll get on okay with. It's about them understanding they can decide that for whatever reason they don't like a particular dentist and move on.
So you started a website called ISDAM, the International Society Dental Anxiety Management, ISDAM.com.
Correct.
It's almost like it's Islam with a D. Instead of ISLAM, it's ISDAM.
At least it's catchy.
Islam with a D. What will these dentists find if they went to ISDAM.com?
Well, you know, I started the society a few years ago out of frustration. As I say, when I started studying anxiety management, I found it very strange that here's a massive thing, and in the UK we say it's 20 to 25% of the population have dental fear. So we've got this huge chunk of the population who are phobic, yet there's no organisation that kind of pulls together the collective knowledge of dentists as to how we help these people. There's sedation societies because we can sell drugs to dentists. There's hypnosis societies. And it was also disparate. But if I want to learn about how to give a pain-free injection, if I want to learn a bit about communication skills, if I want to learn a bit about sedation, I had to go and find and source the different things for this. I had to understand that I need all of those things to be able to help patients, not just learn sedation. So the whole idea of ISDAM was to actually collectively bring together people who are working with phobic patients to produce things like the magazines. And this is unlike any other magazine because you skim through this and there's an article about midazolam, and then in the next page there's an article about hypnosis. And then in the next page, there's an article about pain-free injections. And then the next page, there's an article about how to deal with anxious kids. And that's what it's about, you know. So we do courses. We've got quite a big Facebook group. It's got over 600 dentists and dental nurses.
What's the name of your Facebook group?
Just the International Society of Dental Anxiety Management.
So, not to be rude, but I know my homies.
Yep.
And the minute you say hypnosis, they're thinking of some hokey guy with a pocket watch singing, "Follow the watch, 1, 2, 3."
And you're under.
Is that what hypnosis is? What was that sweet? It was a pocket watch, wasn't it?
Yeah.
Because that's what they're thinking hypnosis is.
Of course. Okay, so where should we start with it? Way back. Let's go back. So hypnosis has been around for forever. It's used in advertising and everything, but way back it was started by the Greeks in sleep temples. We then get into the Middle Ages where there was a belief that magnetism could help. Have you heard of being mesmerized?
Yes.
You heard that phrase, being mesmerized?
Women tell me that all the time.
Yeah. That must be pretty powerful mesmerism. Yeah. So Franz Anton Mesmer, he believed that you could cure medical problems with magnetism.
And magnetism is mesmerized?
Yeah, and that's where mesmerism comes from. So he believed that you could use magnets to cure people. And actually he had a very good success rate, mainly because in France at the time, people were dying from the medications they were getting. They were, you're ill, Howard, so I'm going to give you a course of lead, and then we're going to take out a quarter of your blood and we'll see if that cures your baldness, and folk were dying because of what the medical treatment. So Mesmer wasn't killing his patients because he wasn't giving them medicine. So King Louis XVI eventually said to him, I want to see, is there something in this? Do magnets actually help curing people? And it was the very first controlled blind study that was carried out. And Mesmer had to, what he did weirdly was he magnetized a tree, or a student magnetized a tree, and some patients sat under the mesmerized tree and some sat under a control tree. They didn't know which tree they sat under. And at the end, they had a look at the subjects. Was there a difference between the magnetism and the control? And the answer was no. It was the same. And they said, magnetism is rubbish. It doesn't work. Away you go. What they didn't see the significance of at the time was that both groups got significantly better. So it was really the first demonstration of the placebo effect. Now, what is the placebo effect? Because people say, is hypnosis not just placebo? Well, placebo is, I give you a suggestion with an expectation that you're going to get an effect from this thing. And I give it to you as a sugar pill. And I say, you take this and your headaches are going to go away. Okay, your headaches go away. Was that because of the sugar pill I gave you? Or was it because of what I said the expectation of what you were going to do was going to have? And it was because of what I said. If I just gave you the sugar pill and I didn't tell you what it was meant to do, it would not have an effect. So actually it's the other way around. Placebo effect is suggestion. So we then had a Scottish doctor called James Braid, who watched a mesmerism demonstration, and he was the first guy that said, this is not magnets, this is nothing to do with mesmerism, magnetism, this is psychology. And when he watched the mesmerism show, he said, you know what, this time next week I'm going to hire the same hall, I'm coming back into town, and I'm going to do the same thing just using words. And that was the first use of hypnosis. So hypnosis has been around. It's used in pain control. It's used for curing phobias, anxiety, stopping people grind their teeth. It's got huge numbers of applications. But again, the issue is, it's like everything else, it's not a cure-all. This isn't a panacea. It won't work with every patient. But for the right case and the right circumstance, it's very, very powerful.
And, they say every business should have a unique selling proposition. You have to be different than all your competitors. Do you think advertising and marketing and trying to develop a practice that focuses on dental anxiety, do you think it's a practice builder?
Absolutely. Yeah, because again, I get a lot of patients who will come to me and say, Mike, I'm not anxious, but I see what all the phobic patients have said about you and how well you've looked after them. Now, I don't have a fear of dental treatment. I just want to feel well looked after. So you find that your practice grows exponentially.
You said the United States you thought was 9 to 15% don't seek care. But you said a higher number for the UK. What did you say? Yeah,
there's different studies. One study said between 20 and 25%.
Why would the UK have a 10% higher phobic patients?
It depends on the measures they've used and the honesty of the person answering. We know statistically, if you ask the population, do you think more males or more females have a phobia of dentistry? What would you say?
I think males.
Okay, the research shows females. Okay,
really?
Do you think it's correct? Or do you think when you ask a guy, are you scared of the dentist, that they're going to say, no, I'm fine with that, because it's bravado. And actually a lot of my most phobic patients are guys with tattoos. They're in the army, they're in the navy, they're bouncers in nightclubs, they're doormen, they're criminals, they're top folk in the police, they're hard people. And the problem they have is giving up the control. They don't give control to everybody. But I'm going to sit in this chair and you're going to put something sharp in my face. Nobody does that to me, And maybe
So you said sharp in my face, all these word associations. I know I can't say this on the deal, but I'm going to say it anyway. One of the biggest professional football players of the Arizona Cardinals was Luis Sharp, and he was my patient, and he was just so big and strong, and you'd watch him. I'd go to the games, and I mean, it was just like you could run through a wall. Mm-hmm. But when he got in a dental chair, he was a little teddy bear.
But you often get this almost like a spontaneous regression. So a big tough guy like that will start behaving like a little kid, because the last time he was out of control, he was a little kid in the dental chair. So to give up that control. But again, there are so many different forms of dental phobia. So for some folk it's that. For other folk it's embarrassment. They're ashamed to let you see their teeth. Now, I'll let you guys into a secret, because Americans think Brits have got terrible teeth. Your teeth are just as bad as ours. It's the same. I've worked in Australia, I've been in the States and in dental offices. It's the same everywhere. There's no difference between
I
teeth.
would say there's a difference. I think America has worked because the UK doesn't have a meth problem.
That's true. Yeah, that's true.
And the one thing I've noticed from 30 years ago to now, and even my friends from my exact classmate that went to like Bakersfield, like Chip Castine and Scott Dahlquist. I mean, when meth hit Bakersfield, California, when meth hit Apache Junction, Arizona, I mean, the number of, I can give you names of dentists who did a denture a month or a denture a quarter the first 10, 20 years of practice, and now are at 2 dentures a week.
Yeah.
And so meth, it turns off the saliva, and you can go from teeth as nice as yours and mine to start losing them all in 6 months. It's crazy.
Yeah, absolutely. And a patient, whether they have had a drug problem or not, because patients who've got very bad teeth will fear the judgment of this dentist will think I'm a drug user, a junkie. Whether that's true or not, there's then a perceived judgment on that person because of the state of their teeth. And that can be a barrier. This guy's going to lecture me. You know?
I don't want to get off topic, but why do you think the UK didn't get hit by meth, and why do you think the United States did?
I've no idea. I don't know. We just don't. But it's not a problem. Crystal meth is just. I don't think I've ever seen a patient that's on crystal meth ever.
I think it's got to be the most insidious drug addiction. I think from what I can see, I think I'd rather be an alcoholic or heroin than.
Well, and the weird thing, as far as I'm aware, is it's produced, it's manufactured. So there's, as an island, we've got the opportunity of protecting the border for drugs coming in. And crystal meth is one that is synthetically made, so you would think it would be more widespread, you know. Maybe it's just it took off in the States, and people here could see what it was doing to people before it took hold. I don't know.
You go back to the stopwatch. Where did the stop? Where did the swing? You didn't answer that.
I didn't know that. So that was James Braid. He was the guy that watched the mesmerism and said, "I'm going to do this." And one of the things.
So when he was just using words, you said he just did it with words. But was he just swinging the stopwatch?
Yeah. The first thing that you need when you're entering what's known as trance is a focus of attention. So the very first times Braid used hypnosis, he asked it was his wife and his friends and family, and he got them to stare at a cork on the top of a bottle of wine, and they stared at this while he talked at them. But he very quickly moved on to fixing attention on something that he had on his person, which was a pocket watch. But it can be anything. We'll use a mark on the ceiling, you use your own thumbnail, a pen, but that focus of attention helps to induce the experience of trance. And that's why, if you're watching a good movie on TV, you begin to go into a form of trance because of your focus of attention. Trance is a frame of mind where you become less aware of the world around you, and you're more aware of your internal world, your thoughts and your feelings, and it's natural. Okay, you drive, yeah? Have you ever driven down you call it the freeway instead of the motorway? You're driving down the freeway and you think, when did I get to this part on the road? I don't remember driving to here. Has that happened to you before?
I had the bizarrest thing in my whole life in a car that ever happened. I don't know if I told you this. I went to dental school in Kansas City, and my mom and my little brother, who was 17 years younger than me, lived in Wichita, and it was a 3.5 hour drive home. So on Friday, one time, I was driving home after school on Friday, and all of a sudden I saw the sign. It said Oklahoma City, 80 miles or something. I'm like, what the heck? I drove past Wichita. Yeah. The exit on which I drove past it like 30 miles. And stone sober. And I'm like, what the hell was that?
That was trance. Yeah, that was trance. We enter trance, and everyone's had it. You're sitting at rest, and all of a sudden you've been staring at the wall for 30 seconds. It's in a daydream. Everything's going slower. You go into trance as you fall asleep at night. If you think of it as a level of brain activity, you've got consciousness and awake up here, and you've got being asleep down here. And then right in the middle is this little narrow band known as trance. Now, the perception is, we know that your level of consciousness and alertness moves up and down. We're very engaged because we're sitting talking to each other, but people listening to this, at times will be tuning in and out of what's being said. So your attention goes up and goes down. You're still awake, but you can tune things in and out. We know in sleep, you can be in a deep sleep or be in a light sleep, REM sleep, and it moves in this pattern. This little band in the middle is the same. You can be in a deep trance, a light trance, but it's this little daydreamy zone in the middle. So people say, what's it like to be hypnotized? You already know. The only difference between an everyday trance, when you enter it spontaneously, and when I help induce it, is awareness. When you have a natural trance, wow, you're aware of it when you come out. I was miles away. When we do hypnosis, we're going to enter that, so you're aware of it. It can be prolonged and maintained, but it's the same daydreamy type experience. And when you're in that zone, and when you're in trance, you will accept suggestions and ideas more readily on the proviso that they're acceptable to your belief system. Okay, and this is the crux, because people say, hypnosis won't work for me, or I had hypnosis to stop smoking. It was rubbish. I walked out and I could smoke straight away. That's because you want to smoke. Okay, I can't make it, and that's a great example. Hypnosis has got zero control over your will. If you want to smoke, I could give you all the amazing techniques I've learned over 20 years of studying it. It ain't going to work. It won't stop you smoking. But if you want to stop smoking, I can say some stuff that will change and help you get there. Think about a film. You know, you watch a movie about a topic that you're passionate about and you believe in it. You're in trance as you watch it. You're engaged. And at the end of the film, if the moral of the film is acceptable to your belief system, you think, wow, that's changed me a little bit. I think a little bit differently about that. But if you watch a film about something radical, ISIS or Nazi Germany or something that's so against your belief system, you can still be engaged in it and watch it. But is it going to change how you feel about that topic? Not in the slightest. That's against your beliefs and your morals.
They say never, ever, ever talk about religion, sex, politics, violence. So let's go straight to politics.
Okay.
Around the world, you can't ever talk about Adolf Hitler because he was just so... he started a world war that killed 100 million people. He tried to exterminate the Jews. He killed 6 million of them. But you have to admit, he obviously led Germany to do all this. So he had leadership communication skills that were effective. Yeah. You can call him evil, which he was, but you can't call him non-effective communicator. Yeah. What did you think of Adolf's communication skills?
This is the thing. When you obviously retrospectively we know now what his objectives were, and we know what he was all about, and he was a bad apple. He was a bad guy. But if you listen to and watch some of how he engages with people, he knew what the need was, which was, we're broke, Germany's broken, we're seen after the First World War as a second-class nation in Europe, and he rallied, he worked on feeling, he worked on emotion, and he got people going. They didn't know what his ulterior, his under-the-surface motives were, what he planned.
But it was simple, and chance, and, it was...
And it was passion. It was passion, and people connect with passion far more than they connect with the actual message itself. So he didn't waltz in and say, we're going to open concentration camps. That would never have happened. He got in there and he got people passionate. He worked on their national identity, the fact that they were trodden down, poor, and folks saw hope, and hope is massive. So people latched onto that. And I think we're blinkered and just didn't see, and that's the same of any thing like that across the world that happens. You don't see what's happening around you, and people then, you say, well, how did you get all the people doing the things that they did? But a lot of these people, again, with psychology, they were deferring responsibility. So the guys that were in the concentration camps were often, I've been told I have to do this, so I do it. It was not me,
And I also noticed the successful politicians, whether they're evil or successful, they don't talk all this complex solutions, confusing and all that. They just simple, agreeable things like, we're broke. Yeah. Everyone agrees. Yeah. We need help. Everyone agrees. Yeah. And just simple, agreeable statements.
Absolutely.
And just building up their to where first it's simple, I agree, next simple, I agree, and next thing you know, they're all cheering and rawing, and they've all agreed to just 6 set statements that nobody could disagree with.
Well, think about it in advertising, okay? If I wanted to sell a candy bar, okay, am I going to create an advert that's got 1,000 words that I'm going to talk about the sugar content, the carbohydrate content, how we manufacture it, what we're going to do with the wrapper? Or do I go, you're hungry, I've got sugar, okay? You're going to go, I'm hungry and I want to eat that. Okay, you don't know about everything else. And in politics, most politicians get too bogged down with long words, complicated solutions. They're intellectual, intelligent types of people, when actually people vote on feeling. And how does that guy make me feel? How does that woman make me feel? That's what's going to get my vote 10 times over what they're actually saying to me.
Okay, so my homies out there, they only got a couple minutes.
Yeah.
How do you build a rapid rapport, trust, make you feel better? Because you know, I mean, it'd be nice if you just made a patient say, you know what, let's go out for lunch. You know, let's just, you know, wouldn't that be great to have an hour lunch with every patient before you gave them a shot? So how do you build rapid rapport to get, you know? Okay,
I'll give you a quick synopsis of some of what I think are the important aspects, but I will get a course out on Dental Town. We'll do it properly. I talked all of yesterday on it, so
it's so important because again, the problem with my homies that when they see a patient like this, they just want to go take some sedation course and knock them out. Yeah. And you can't go a month in America without reading a newspaper story that's on the news, on video, all over the internet of someone dying in a dental office. Yeah. And I look at so many of these cases and I wonder how many of these could have been prevented if they'd been trained by someone like you and just learned how to talk to this patient, give a pain-free shot, you know, get them relaxed without having to be the American, hit them over the head with a bulldozer of some narcotic, and you know, it's just extreme anesthesia is not always necessary.
Well, I think
well, if everybody had your training, what % of the IV sedation do you think could be reduced in the United States?
90%.
I know,
90%.
So I'm on a mission to get your word out in America.
Yeah, and as I say, you can combine things. So all the patients who I still sedate, the way I'm communicating and the words I'm saying to them, I know that at the end of the sedation, they're more than likely than not going to say, do you know what, Mike, next time, either can I get a bit less sedation to see how I get on, or I don't think I need it anymore. Yeah,
because you're treating the disease of the anxiety instead of knocking the mind off and treating a molar.
Yeah, when somebody's sedated, it's actually quite similar to being in trance or hypnotized, and it's a great opportunity to say the right things to them. Now, they won't necessarily have a conscious memory of what you've said, but they will have a feeling that's still there because that's hardwired in. They're awake. They'll remember a feeling. So if it hurts and if you swear and you're horrible to them because you think they're not going to remember, they're still going to hate you. You're still going to hate dentists. If you say the right things to them, when I give an oral injection to a sedated patient, I use repetition, and repetition is very powerful. And I say, "This is easy, isn't it?" And they go, "Huh? Yeah. Yes, it's easy. You're having an injection and it's easy. Howard, you're having an injection. It's easy, isn't it? Yeah. What's happening? I'm having an injection. Is it easy? Yes. Repeat. At the end of the sedation, when they come out of it and they're going, "That's great, I don't remember anything, and you know, I've got no memory." And I say, "Well, do you remember anything?" And they go, "Well, I remember the injection was easy." And I think, yes, you remember the injection was easy. Now, your amnesia should probably be the strongest at that point because you've had the sedative. So these techniques are, and that's what I was saying at the start about the cocktail. You mix it all up. Now, you asked and that's just one example. You asked about how would I manage a phobic patient. I've got a thing that we'll maybe do on Dental Town. It's called the Therapeutic Consultation. And it's using all the things I've learned from psychology, from hypnosis, from CBT, and it's packaged into a way of communicating with the patient on the first visit that I know at the end of it will have them smiling and saying, "I've got hope, I trust this guy, I trust this practice, and I want to get started with my treatment." Okay. The very first thing I do is obviously rapport building skills. So I use body language, I avoid negative words, I avoid emotive words. But the first thing I want to do when you come in to see me is ask a question, which is, what can I do to help you? What are your goals? Why are you here? When I started in phobia management, I did what I was taught, which is the worst thing you can do with a phobic patient is, what's the problem? If you ask somebody what the problem is, you better have a half-hour appointment and lots of tissues and lots of patience, because they're going to cry, they're going to get upset, and they will go through every bad dental experience that they've ever had that's led them to now. And what happens when you talk about a bad experience that you feel bad about? You start getting the same feeling again, you know? And every time I come in, it's awful and it's painful and nobody understands, and they get into that mindset, and you go, okay, we might have to refer you, I don't know, but I don't have time just now, I'll see you in a week. You've just anchored a bad experience. They've come into your office and they've had a bad experience, and they leave thinking, it's just the same, it's just the same. So the first thing I do is say, what is your goal? What do you want? And it's a bit like getting in a cab, all right? At the end of this podcast, if you were to go out onto the street in Glasgow here and get in a cab, and it's the same with any cab in the world, and you sit in there and say, do you know, I had this great podcast with this dentist, Mike Gow, and we talked about hypnosis and phobia. Now, let me tell you, I don't want to go to London today. I don't want to go to Glasgow. I don't want to go to Aberdeen. He's going to be sitting and the meter's running, and he's going, Howard, this is fascinating stuff, but I don't know whether I go this way or this way. I've got no idea where to go. What's the first thing you do when you get in a cab?
Tell them where you want to go.
Destination. I'm going to Edinburgh. Excellent. Now, we're off. We're going. Howard, there's 3 ways to get to Edinburgh. Do you want to take the motorway and we'll get there really quickly? Or do you want to take the scenic route, because there's some cool castles and William Wallace and all sorts of cool stuff that these guys will see when they come to Scotland? Which way do you want to go?
Wallace.
Yeah, of course. So goal setting is huge, and that's huge for any patient. This is especially important for phobia, that any patient you get. So that's goal setting. We talk about trust, and I say, I don't expect you to trust me yet. From what you've said, you've had a hell of a time. I know I've got to earn trust from you. Ironically, saying that will increase trust.
Do you think you wearing a kilt increases trust?
I don't wear a kilt when I work with patients. Okay. It would be awkward. That's just for these guys that are watching on the. If you're in Scotland with us, you've got to see a kilt. Make sure I close my knees. No, you don't want to see too much. That's the joke. Do you know what people say to a Scotsman will never tell you what he wears under his kilt, but if you buy him a whiskey, he'll show you. So trust is important. Control. So I teach the patient a stop signal. Now, most of you guys will have been taught about stop signals. Put your hand up and I'll stop. But I say to the patient, look, if in any other situation, if another human being is in physical contact with you and you say, Mike, take your hand off me, and I don't do it, that's assault. Okay? So while I'm in your mouth, I might have a mirror or be doing anything. If your hand comes up, you've removed consent for me to be there, and I'm going to get out of the way as quickly as I can. And then they know you're taking this as seriously as they are. Now, I say, you might want to put your hand up to ask a question. You might need to sneeze. You might want to cough. You might want to have a rinse out. I don't know. I don't say because it's painful, but I give them a whole list of reasons why the hand might go up. And I say very few patients put their hand up, because guess what? I'm trained in communication skills. I'm going to be watching your body language the whole time. I'm going to be watching your facial expressions. What are your eyes doing? If I even for a moment suspect that you're feeling worried or anxious, or you've got a question, I'm going to stop and just check in on you. How are you doing? What's going on? Are you okay? So very few people get to the point of putting their hand up. We talk about embarrassment, and nobody ever told me this when I was a student, but phobic patients are embarrassed. They're embarrassed about their phobia because it's a weakness. They're embarrassed about how their teeth are. I've not been for 30 years and my teeth look terrible. And the worst thing you can do as a dentist is look in there and go, oh, this is bad. Or when was your last visit? How often do you brush your teeth? because they know this. They feel bad. They don't need you to tell them that. I always thought that a female phobic patient would prefer a female dentist. That's what you would think, yeah? Not the case. I get female after female coming in who says, and I say, look, if you want a female dentist, we can provide a female dentist. And they say, Mike, don't take this the wrong way, but you're just a guy. I'm worried if I see a female, she'll be, did you see that girl's tooth? How bad her mouth? She had, the nicest purse. She's got nice makeup. Her teeth were awful. You're just a guy. I know that you don't think like that. So that really surprised me. So avoiding embarrassment and avoiding judgment is huge. It's massive. I get patients that is their only barrier. They've not been for 30 years because they're scared of me seeing their teeth. And I say, look, I'm a dentist. I'm going to be totally honest with you. I feel the same way as a car mechanic does when he lifts the hood. I've got zero emotions about your teeth. I'm looking at the foundations. I'm looking at what is there for me to build a new smile on. Okay. Now, some patients' goals are different. You'll have patients who are wanting their smile to look nicer. There's some patients that want to be out of pain, and there's some patients that want to be able to chew better. And it might be a combination, but it's one of those goals. So when I'm speaking to them, I say to them, the first thing we're going to do is start getting things looking better. So I'm going to deal with the thing that they want fixed first, rather than what I perceive as the most important thing, because I'm the almighty dentist and I've been told that you need to do this. If somebody has said that I don't have a job, I don't have a partner, I don't leave my house because I'm so ashamed of my teeth, okay, am I going to say to them, well, I'm not going to start your front teeth until we've worked on your back teeth? First thing I want to do is give them some confidence back in themselves. If you take your car to get fixed because you've got a puncture, and then half an hour later the guy comes out and says, well, Howard, yeah, you've got the puncture, but you've got a hole in your exhaust, your spark plugs are shot. Tell me, what oil are you using? Because it's not the right oil. When was the last time you washed your car, Howard? Because I'm going to be honest, it looks bad. Have you ever hoovered it? Have you ever vacuumed inside your car? It smells in there, and you're sitting thinking, I just needed my tire fixed, I just wanted a new tire. So find out what they need and address that first. And I give them hope. When a phobic patient sits in my dental chair, when I first look in their mouth, the first thing I do is I say, that's excellent. And I step back. And they look at me and they think, what? My mouth's the worst in the world. How could that be excellent? And I find something, anything that's positive. And I say, you've got really great lower teeth. I've got loads of patients that would switch places with you in a second to have these lower teeth. So they get hope. I mean, there's so many, I could go on like this for hours and different things to say, but at the end, they read testimonials from other patients, and I ask them, when we finish your treatment and you get your smile back, will you write me a testimonial? I've only met them for half an hour and I've asked them already, will they write me a thank you letter? And they say yes. And in that moment, in that very second, they've projected themselves into a future where they've had their treatment and it's been successful and life can be okay. And they walk out to the reception and they've got hope. And they've found the right place, and we get going. And then, as you guys know, the dentistry is the easy bit. You then change their life with the dentistry. And at the end of it all, you get a pen with your name engraved on it, or a bottle of whiskey, or a box of chocolates, and a hug. And you get to go home getting paid well and feeling amazing about the work you're doing to help people.
Well, you're amazing, and you're helping so many people. And, it's amazing because when you meet people, you always trade compliments. Mm-hmm. And hey, you're looking good. And so many times the dentist will look in the mouth and go, wow, and it's negative. I mean, I've had one of my famous one-liners for 30 years, they'll say, I got horrible teeth. And I'm looking at their mouth and I'm like, what are you talking about? You got 6 teeth in a row here that have never even had a cavity or a filling. Mm-hmm. And you're 50 years old. You've gone half a century, and these 6 teeth, 6 in a row, never even had a cavity. What are you talking about? And I say, this is America. 10% of people at age 64 don't have 1 tooth, and you've got 6 in a row. never had a cavity in 50 years. You gotta. It's all it's the soft skills for the mental, not the hard skills for the molar.
Yeah.
But I'm your biggest fan, Mike. That was the fastest hour I've ever done. Are you going to promise these guys you'll do an online C course?
I promise. It's
someday you want to come to Vegas and lecture to my homies at Townie meeting?
I'll be there, and I might even bring the kilt.
Oh my gosh, that would be awesome.
Let me tell you, we've got two minutes, and I'll tell you. I'll tell you a quick thing. I've got a fascination in dental history and the history of hypnosis. And there was a guy who worked basically through this wall called William Dahl. And in the 1890s, this guy was using rubber dam. He was doing root canals. I mean, he was amazing with the work he was doing. And he was, after he created a prep, he would measure it with calipers, and then out of a piece of ceramic, cut the ceramic and then glue it in the tooth. Amazing guy. But the thing I loved about him the most was, and he's written a book on this, he travelled the world. He was using a burr, and he thought the diamond quality is rubbish. So he went to South America, he went to South Africa, he sourced his own diamond and brought it back to Glasgow with his own stuff. He pioneered new techniques and using furnaces and all this kind of stuff. My favourite thing that he did was he would go off to India, he went to Indonesia, he went to the most far out there, and this is like 1890, in the middle of nowhere. He'd find somebody and say, what do you do with your teeth? What happens when your tooth's broken? And the person would take them to the local dentist, and he would say, can I pay you to sit and watch what you do? He would watch the procedure, and at the end of it, he would say, see the tools, all your equipment, how much did they cost you? And the guy'd say, $10. He'd be like, I'll give you $100. You buy yourself some new stuff. Can I take these? Brought them back to Glasgow, where he started developing, changes to what we were using in the Western world. And I think that's amazing. That's what you're doing with Dental Town. You're getting out there, you're interviewing dentists, you're picking up ideas, and you're passing it on, sharing it, and it's brilliant. And I love it. So keep doing what you're doing. It's amazing.
Now that you said one of the greatest dental museums in the world is right here in Scotland, in Glasgow.
Yeah, the Royal College of Physicians and Surgeons.
So can Ryan, Greg, and I see that Monday? This
absolutely,
is Sunday.
Yeah.
So
it's literally a 2-minute walk from where you're staying.
The dental school?
Is it the Royal College? I think.
It's a 2-minute walk.
Yeah.
Huh. So today, can you show us where that is? And
we'll drive past.
Do you think they'll give us a tour of that?
Yeah.
That'd be amazing. I love dental history.
I'll post some dental history stuff up as well, because we and this was the whole thing about hypnosis and pain control. When was the first synthetic drug that we used in medicine? The first thing that we put together and said this will work. When was the first one?
The first drug?
The first synthetic drug. So first manufactured.
Synthetic drug. Horsewell's ether?
No, it was 1899, and it was aspirin.
Okay.
Right. Now, since then, if you look in the UK, we've got the formula, which has got all the things you can prescribe, and the book is that thick, and the vast majority are stuff we synthesized. So you telling me that humanity has got from the Big Bang to the year 1899 with no synthetic drugs, but now we need all these medications to cure every problem. No. What did they do before then? Fair enough, we had plants and we used various things, but what else did we have? We had compassion, we had human interaction, we had understanding, and you know what? That works as well. Let's use them with conventional medicine. I'm not saying use all this instead.
I think it's so funny because when you talk to a dentist, they've completely given up on the U.S. healthcare system, which is basically you just go in and tell a doctor your symptom, and they write your prescription for a pill. And all my homies don't believe in that system. Yeah. Yet when a patient walks in and says, I'm looking for alternative care or a homeopath or a natural doctor, they're like, are you a quack? Mm-hmm. It's like, buddy, you are a homeopath. You are a naturopath. Yeah. When my doctor told me at 50, you got to lower your cholesterol, and you got to, your cholesterol's too high, and you need to take a statin, and your high blood pressure's too high, and you got to take a blood pressure pill, and all these things. I signed up for Ironman, and at the end of my first Ironman, I went back on my physical, and he said, I couldn't have got your numbers this low with the statin
Drugs,
or blood pressure. In fact, when he takes my blood pressure, he still can't believe it. He goes, God dang, you're 53, you're fat, you're old, you're almost dead, and you still got a blood pressure of someone who I would think is a marathon runner.
Yeah.
It's like, well, I am running every day, and so they're all naturopaths.
So here's the thing. This is one of the things I produced, which is an audio thing for people that grind their teeth. The research in bruxism is very hard to know why people grind their teeth, and I think the reason for that is it's different for different people. So I'll maybe put it up as well. I've got a questionnaire that I developed.
Now you want this? You sell this on your website, or you want me to put it up? Or
yes, I sell this direct to patients, but I'll get it on iTunes. We'll get it so that people can buy it. But
do you want us to put it on the podcast?
Sure. Yeah.
So how long is this?
It's an hour. But that's for patients, yeah.
And then how long is this?
That's a video. It's about just over an hour, I think, an hour and a half.
Yeah, well, whatever you want to do. I mean, Ryan could put this up as another 1 hour podcast, or you could start a thread on Dental Town and show the video. Yeah. Or you can just talk about it on a thread that they can buy it on your website.
Exactly. If the patient completes the questionnaire and you think that stress or anxiety or something is going to impact on their bruxism, then as well as giving them their NTI or their splint that you're giving them, then give them a bit of emotional support as well, whether it's this or something else. But if they're stressed and that's part of their bruxism, then help.
Okay, well, Mike, again, what an honor.
Thank you.
Thanks so much for letting me. And by the way, Greg and Ryan loved your course too. They were talking about it all last night at dinner and all that stuff. And
good stuff. Well, listen, anybody who's out there watching or listening to this, do come and have a look at isdam.com, ISDAM.com.
Islam with a D.
Come and have a look. Come and have a look, because and if you enjoyed this, tell your buddies, have a listen. And if what I've said here today helps make a change in other dentists, that helps other patients, everything's worthwhile. Let's make a difference.
And that's what this show and Dental Town website and the Dental Town app is all about. I just knew that if you get all these dentists on the same page, someone in the room has the answer to every problem they have. Yeah. And you just got to get everybody sharing their ideas. And if everybody shared their ideas, if all 2 million dentists on Earth shared all their ideas with each other seamlessly for free on the internet, a website, we'd all be able to help our 7 billion patients so much better. Thanks for all you do, buddy.
Let's go and see some castles.
Okay, let's go.
Although nothing could have prepared me for my next stop in Scotland. I was here to meet a dentist who'd been using hypnotherapy to reduce the pain of treatment. That morning, he'd be doing something not even he had done before. Teeth extraction, an implant placement with no conventional anaesthetic, just hypnosis.
Imagine waking up in the morning, having had quite a sleepless night, thinking some bloke is going to rip my teeth out and I'm going to be hypnotised, so it's not going to hurt. It's just remarkable. I'm so glad that it's not me.
It was Amanda. She'd only had 5 hours of hypnosis to prepare her for this morning. But today, she'd have her 2 front teeth removed and 2 implants inserted.
Why did you want to have hypnosis rather than anaesthetic? What made you think that?
I just do ordinary things, go to work, come home, go for a walk, and it's just doing something like this. Ordinary people can just do something like extraordinary, and I thought, I'll give that a go and see if I can do that.
Good morning, Mandy. How are you doing?
Oh, fine.
Good to see you. In you come. Have a
Mike
seat
Gow is Mandy's dentist and hypnotherapist.
Sit all the way around onto the chair. That's it. Yeah.
That morning, Mandy had taken a couple of ibuprofen. I can tell you, they'd make a minimal difference to what you're about to see.
Perfect. Definitely. Excellent. Good stuff. And I want you to give yourself that signal again, that anchor, okay? And I want you to re-access those positive feelings, the feeling relaxed and positive, okay?
Mandy's anchor, a mere hand shape, seemed to send her off.
Today, the procedure that's happening is to improve the health, improve the function, improve the appearance of the body, isn't it? So for that reason, You'd be surprised by how easy you find the procedure today because...
Mike spent about half an hour helping Mandy to focus and suggesting that she shouldn't expect pain. Then, a different sort of hand signal. And suddenly, it all felt very real.
Just relaxing deeply into the chair, being tucked in, safe, to be entirely comfortable. One way of learning how to do this is to imagine a comfort dial. Visualising in your mind's eye now this comfort dial. You're very easily able just to turn the dial down, aren't you? You can take this pad in your hand and hold on to this pen. I want you to think about that dial now and just write down the number that you can see and feel the comfort dial is at right now. That's right, a 0, completely comfortable.
If the number got to 6, Amanda would be given a dose of local anaesthetic.
Noticing just how far up in the mouth, the nose, the lip.
They were going to monitor Mandy's pulse throughout.
Completely numb as you feel
So was I.
pressure. You can write down another number there. It's
Before
right for
long,
you to
the
turn
dentist
dial
started to
left,
loosen the tooth.
leaving behind
It was about to get grim.
0. You can zero in on the comfortable sensation and just write down another wee number there. A 0, completely comfortable. Comfortable pressure. Enjoy relaxing on the beach.
While Mike was innocently talking about a beach, out came the first tooth.
Feeling relaxed and calm. Just write down the number the dial is at right now. A 0.
How could she write a 0?
Comfortable sensations as you walk along the beach. Perhaps you have your shoes off and you can notice the sand between your toes is wet, or whether the sand is dry and warm and fluffy. And as you feel the movement and the pressure, you can allow the altered sensations, the feelings of comfort. So turning the dial down, just writing down a wee number for me there. A 2, okay, turning that 2 down, because it's right to turn down the number 20. Just write down the number again now. Where's the dial at now? A 1, and you can turn the dial from a 2.
That was hard
to
enough
a
to
1.
watch. But then came the drill.
Quite a satisfying feeling to know that you can control the sensation. Choosing at any time just to write down which number feels right. And 1.
This was all taking a long time, and her pulse hadn't changed.
To drift away, separating
Mine sure had.
mind from body. Enjoying this perfect day at the beach, the perfect weather. Enjoying the way
I hoped Mandy was really on the beach.
off the sea. A 1.
I certainly wasn't.
Comfortable 1, because it's right for 1 to feel comfortable. And it's interesting that there are so many colours and so many different shades in these grains of sand. Just continue to relax while I speak to Kathy.
Mandy's pulse has stayed incredibly low. I mean, my pulse was higher than that.
Because she's relaxed.
She really is in a comfortable place.
Yeah. And you can demonstrate that by, again, Mandy, if you just write down the number that's on the dial right now. It's a 0, completely comfortable. Knowing that when the healing
Finally,
process is
1.5 hours later, we were almost done.
the area is feeling functional and healthy again, and the smile will be perfectly complete.
I felt utterly drained. What about Mandy?
To come back into this room so that you can feel more and more alert, more and more awake. That's right, open your eyes, feel wide awake, alert. Fantastic, well done, very well done. Great. Good, so I shall set your chair up there. Your pulse is now higher than it's been the whole day.
Yeah.
What's your pulse now?
It's up at 82 now.
Loads of people in the room.
Yeah. 86. What was that, actually, out of interest? What was the highest number? Do you recall? I think it was a 3.
I thought my pain would be way up high, do you know what I mean? I was quite surprised that it wasn't as sore as what I expected.
And what was the worst thing about it?
Just, I think they must have been getting kind of drilled in. It was just that kind of pressure feeling. Can I see? Is it kind of messy?
No, not at all.
And do you remember everything?
Aye.
And
I mean, I mean, you can hear things like going about, but I actually think you'd gone away. That's amazing.
And how does that feel now?
Good.
You know? It's deeply impressive. You look like you were in a more comfortable place than I was.
Yeah.
That was amazing.
I couldn't quite believe they were really pulling his teeth out. What was going on?